We're live.
Good morning and welcome to the fifth meeting of the House Cannabis Legalization Workgroup. This is a virtual workgroup meeting, so please be patient if we have any technical difficulties. But we are being live streamed. Remind everybody that we're being live streamed on the Maryland General Assembly's YouTube channel. Workgroup members are going to be muted during the briefing. If you have a question, use the raise your hand function on your Zoom window. And after I recognize you to ask a question, you'll have to wait a minute while Dylan unmutes your screen. Today, we're going to have a series of briefings related to the taxation of cannabis and the revenues that are projected and established in states that have pursued cannabis legalization. First, we're going to hear from Carl Davis, the research director at the Institute on Taxation and Economic Policy, and he'll provide an overview on cannabis taxation in other states and the options for structuring taxes on cannabis. Next, we'll receive a summary on the mathematical analysis of potential tax revenue related to cannabis legalization from Will Tilburg, the executive director at the Maryland Medical Cannabis Commission. And third, we'll be joined by Stan Ward, a principal policy analyst at the Department of Legislative Services, who will discuss local cannabis taxation. After they all make their presentations, we'll open the floor to questions between the workgroup members and panelists. I'll ask everybody on the workgroup to keep note of your questions and be patient as you hear all the presentations, and we'll get to all of your questions at the end. So with that, I'd like to go ahead and ask Mr. Davis to begin. And when you're ready to go, here we go with a PowerPoint presentation and everything. That's fine.
Okay. Thank you, Mr. Chairman, members of the work group, for allowing me to speak with you today. I'm Carl Davis with the Institute on Taxation and Economic Policy, or ITEP. On the next slide, we have a little bit of information about ITEP. We're a national research organization, both nonprofit and nonpartisan, doing work on state and local, as well as federal tax issues. And a growing part of our work recently has been in the cannabis tax area, just because this is an emerging issue in so many states. Next slide, please. We have a little bit an outline of what I'm going to be talking about today. So I was asked mainly to comment on options for structuring a cannabis tax. So I'll do that, and I'll offer a little bit of an overview of what structures other states have chosen. I also want to talk about the trajectory of cannabis prices, which I think is just enormously important for certain types of tax structures you might be considering. And then I'll close with a few different observations I've gleaned from following debates in other states. But my next slide is really the core question, I think that's confronting you on the tax side. And that's really what is the tax base going to be? And you have two broad options here, those being taxing either the price of cannabis being sold or the amount or the quantity being sold, irrespective of what the price happens to be. And so a price tax is basically like a sales tax. If a customer spends $50 on cannabis, pays a 10% tax, that's $5 in taxes. This is often called an ad valorem tax. I tend to refer to it as a price tax just because that's a more familiar term, but it's the same idea. On quantity taxes, there are two different ways to measure quantity. Both of these are in use right now or about to be put into use very soon in some states. The more common approach is to measure the amount of plant material being sold, the weight, and then to apply a flat tax to every ounce or every pound that's being sold. So in Alaska, there's a $50 tax on every ounce of cannabis flower, regardless of what the price of that ounce happens to be. More recently, though, we've seen a growing interest in taxing not the plant weight, but the quantity of the actual intoxicant in cannabis. And the main intoxicant is called THC. There are others, but the one that's most significant and the one that states are zeroing in on for tax purposes is THC. And under this kind of tax, what you tend to see is a flat number of cents on every milligram of THC being sold. Again, it doesn't matter what the price is, it's how many milligrams are you buying that determines your tax amount. In a way, I think this really gets to the heart of the matter, presumably the reason we're talking about an excise tax on cannabis as opposed to just taxing it at the regular general sales tax rate is because it's an intoxicating substance. So if it's the intoxicant that you're concerned about, that's the appeal of that approach. On the next slide, a little bit more detail. My next 3 slides are going to be a little detail on each of those options. So with a price-based tax, what are the advantages? Well, one of them is, premium products will tend to incur a little bit higher tax. More potent products, if they sell at a higher price, which they tend to a little bit. It's not the case typically that if a product is twice as strong, it sells at twice the price. But there is a relationship between price and potency. So in that way, you are with a price-based tax, you're taxing premium products, you're taxing more potent products at a somewhat higher level. Another advantage of going the price-based route, especially if you apply it at the retail level, is that there's not the same need to set up a system for weighing out cannabis and trying to verify those weights for state tax purposes. It's important to note, though, that advantage can go out the window if you try to apply a price-based tax at the distributor level and you have vertically integrated firms in your state. Because, if you have the distributor moving product to the retail level and there's no actual sale taking place, well, then there's no price there to observe and to tax. And so what we've seen in states like Colorado and Nevada, where they try to do a distributor level price-based tax, is they actually end up having to measure weights and verify them anyway, just because there's no sales price. So they weigh out the product and then they assume the price is some given amount based on a study that they do in the market every couple months, and they update the tax in that way. But I just think it's interesting to note some price-based taxes actually get administered using weight-based mechanisms because sometimes it's the only way to do it. Another advantage of a price-based tax is you don't have to draw product category lines. So under a weight tax, for example, you're typically going to see the potent parts of the plant, the flowers in particular, taxed at a higher rate than trim, like leaves and stems, because the flowers are worth much more, they're much stronger. So you have to draw those definitions, like what counts as a flower, what counts as a leaf, what counts as an immature flower. That's a category we see in a lot of states where the flower starts to form, but something goes awry and it doesn't end up achieving full potency and full value. It gets taxed at a somewhat lower rate. So you have to create those kind of categories with weight taxes, not with price taxes, though. And then finally, another advantage, I think there's just a familiarity benefit here. People are familiar with general sales taxes, paying a percentage of the price in tax. And I think that's one of the reasons we've seen states apply price-based taxes. It's something they're familiar with. Next slide is about weight-based taxes. Again, there is some ability to get at potency with this type of tax. As I said, you can tax flour at a higher rate than trim, for example. More significantly, a weight-based tax is not going to be vulnerable to erosion when prices drop in the same way that a price-based tax is. And I do think that significant price cuts are almost inevitable. Under a price-based approach, when prices start falling, your revenue collections are going to suffer, for one thing. Also, though, your deterrent effect of the tax is going to suffer. So if with one rationale you're considering for having a cannabis excise tax is to say keep prices high enough that kids can't afford to purchase it, that deterrent effect gets undercut every time the price comes down. If you go the price-based route, 50% price cut leads to a 50% tax cut. What you end up with is a tax system that actually exacerbates any price decline because you're cutting taxes at the exact moment when prices are already falling. So this is not, though, a shortcoming of weight-based taxes. They're stable regardless of what the price happens to be. Weight-based taxes also, you don't have to worry about potential tax cuts for people buying in bulk. There are bulk discounts at cannabis stores just like anywhere else. Now, there might be limits on how much you can buy, but it's still true you tend to pay less per unit for an ounce than for a gram. So with a price tax, you're effectively taxing people buying in bulk at a lower rate than people who might only buy a gram occasionally, for example. A fourth advantage at the distributor level, this is an easier tax to administer, as I mentioned. And then a fifth advantage is there's also a familiarity benefit here. Actually, in the excise tax sphere, quantity taxes tend to be the norm. We tax motor fuel per gallon, tobacco, cigarettes per pack. So there's a familiarity here as well. It's just a different structure. And then finally, my next slide on potency taxes. If you're concerned mainly with taxing the intoxicant, this really cuts to the chase. You can tax it directly, at least the main one being THC. You measure that, how much there is, and you apply a tax to every milligram. The second advantage is, again, you're not hitched to prices if you're taxing at a flat rate per milligram, so you're not vulnerable to that same kind of erosion in revenue, that erosion and deterrent effect that you might see from a price tax. The third one, I think this is an interesting one. If you're prioritizing THC as part of your tax system, you're creating yet another reason to make sure that THC measurement is done well in Maryland. And I think, making sure product labels that are reporting THC amounts that are accurate is a good thing. It's a good thing for consumers. It's a good thing for public safety. It gives people good information about how much intoxicant they're actually ingesting so that they can control their intake. So you want to be measuring and reporting THC anyway for consumer purposes. And then the last two bullet points, these are just repeats. The last 2 points are repeats from the previous slide. So moving on, excise taxes, quantity taxes are the norm in the excise tax space. Motor fuel, alcohol, tobacco. This is true in Maryland. This is true elsewhere. Now, actually, in Maryland and in a lot of other states, you actually end up with what's a hybrid approach. So alcohol, for example, there's a per gallon tax, but then also a 9% sales tax. So you're taxing the price and you're taxing the quantity. Same is true with cigarettes. I believe they're subject to general sales tax, which is a price tax, but also a per pack excise tax. So you typically do see, though, in the excise tax space, these so-called sin taxes, you do see a quantity tax included in the mix. On the next slide, though, you can see this isn't always the case with cannabis taxes. So right now we have 18 states with legal adult use cannabis tax systems that are in place or about to take effect. And about 2/3 of those states have decided to go all in on the price-based taxes with no weight consideration, no potency consideration in setting the rate. And, I think it's important to note a lot of those are the early adopter states. A lot of those were adopted through publicly initiated ballot measure. Part of the reason that these price taxes may have been included in the early states is simplicity around drafting the legislative language or the ballot language about how the tax would be applied. It's arguably a little bit easier job because you're not drawing product category lines, for example. More recently, when we started to see states pursue legalization through the legislative process, we are seeing quantity taxes pick up steam. New York, New Jersey, Connecticut, these states all very recently enacted quantity taxes. And now with some of the larger states, California included, with having quantity-based taxes as part of their system, alongside price-based taxes. Even though it's a smaller number of states, they're larger states and they're actually home to more people. So more people in states with legalization see some kind of quantity tax in place. The next slide looks at the details on what the quantity taxes are in the 6 states. So there are 4 states have gone with a weight-based approach: Alaska, California, Maine, and New Jersey. And then 2 states have gone with the per milligram potency tax on THC, and those are Connecticut and New York. So for the taxes on plant weight, you can see generally states are choosing to levy a higher tax amount on potent cannabis flower and lower tax rate on stems and leaves. Beyond these 2 categories I've shown here, there are also additional categories oftentimes for things like immature flower or seeds or seedlings. Sometimes these are created by the legislature. Sometimes these additional categories can be created through the regulatory process after feedback with the industry to see what's needed and where the gaps are. On the THC tax side, you also see some category line drawing, and the most significant one is around edibles. Both Connecticut and New York have chosen to levy a significantly higher tax rate on THC sold in edible form, just because consuming it in that matter is so much more efficient. It absorbs into the body so much more efficiently that if you're trying to tax a a given, level of intoxication at the same rate, you have to tax the edible form more than the smokable form to achieve parity between how intoxicated you can get from those two forms. So my next slide, a little bit of a pivot here to talking about what's lying ahead for prices, because I really think when you're thinking about 10 years down the road, how is the fate of these different tax types going to diverge? The most significant thing to have in mind is what's going to happen to prices, and I do think they're going to fall quite a bit. And the next slide outlines some reasons why. For one thing, businesses, the legal market, the legal adult use market in this country is less than a decade old. I think there's been a learning curve in some businesses, and they're learning the ropes, learning to operate more efficiently. And I think that's going to continue to happen. A second issue is that with the legal market very much still in a growth phase, we have a lot of states where there aren't a sufficient number of retailers to meet demand, or they're not located where customers are. When you have legal supply falling short of demand, it's pretty clear that prices are going to be high. When that gets fixed and when legal supply catches up, prices are going to come down, I expect. A third issue is around consumer preferences. We've seen both in Colorado and Oregon and elsewhere, consumers shifting more towards edibles, and the smokable flower is becoming a smaller part of the market. I think there's always going to be a market for, say, artisan flower. Think of it as craft beer. But if people are shifting to edibles, those can be grown effectively on a mass scale, in a much easier fashion, in a much lower cost fashion. The job there of confronting growers is really about producing as much biomass as possible. It's less important to meticulously care for every plant. I just think there's an economy of scale around edibles and concentrates. It's going to be a cheaper form of cannabis to grow, and if that's where the market's headed, we'll see prices come down for that reason. The fourth is around state level regulation. If we see loosening of restrictions on who can be a grower, where you can locate a retail business, those kind of things, if those are loosened over time, I think that boosts supply and lowers prices. But really, the big thing, absolutely the biggest thing I have in mind here is what's going to happen at the federal level. When this industry gets access to really basic things, like banking services, like the same, run-of-the-mill income tax deductions that every other business takes for granted, those are going to lower their costs. And I think they'll lower them in a way that'll partly be passed along to consumers and lower prices when we see that federal legislation enacted. Really, though, the huge game changer here is going to be around interstate commerce. As soon as you can start to move cannabis across state lines, the companies involved are going to become much larger. The grow operations will be larger. They'll take place where it makes environmental sense to grow, where it's most efficient to grow. And I just think we're really going to. I think that's going to be the big thing that brings down prices in a relatively short amount of time. On the next slide, you can see that some of these effects I just talked about are already in play. So this is Oregon, for example, looking at over a 4-year span from November 2017 to November 2020. That's the most recent month where I could find data. The quantity of THC, of intoxicants sold in the state, just about tripled. It grew by 208%. And over that same period, though, the dollar value sold grew at about half that rate. Now, over this period, Oregon still experienced pretty robust revenue growth because its legal market was growing, more retailers were opening up, more cannabis was being produced and sold, so revenues were headed on an upward trajectory. But you can see here how price declines are restraining revenue growth in Oregon, and it's not difficult to imagine how when Oregon gets to a place when the legal supply levels out and you can't count on huge increases in sales every year and in volume of sales, what's happening to prices is going to show up much more directly in Oregon's tax revenue stream. The next slide, please. What are we looking at in terms of a tax cut? Or a price cut, I should say. It's impossible to predict that exactly. I do think this chart, though, shows that there's plenty of room to fall. So if you look at other agricultural products, cannabis is almost off the charts right now. 10 times more expensive than tobacco, 1,000 times more expensive than tomatoes per pound. This chart doesn't look this way because cannabis is the hardest plant in the world to grow. I mean, it looks this way because of the restrictions we have federally and at the state level that are pushing up price. And I think this helps show that how much of the current price of cannabis is driven by policy decisions that could change, as opposed to like the basic science or the basic economics that are going to remain fixed. All right, if we can skip ahead, skip one slide just in the interest of time. This is my last, just a few parting thoughts for you, and then I'd be happy to discuss more in Q&A. But this is a little bit scattershot, but a few things I think you should have in mind. The first is about revenue expectations, of course, a key consideration. And I can say some states have gotten themselves into trouble from not setting realistic expectations about the revenue that's going to materialize in the short term. You can have a long run or a medium run revenue projection in mind, but you need to be aware it's going to take time to get there. And we've seen states like California, a lot of frustration build over revenues not meeting a long-term projection in the first year and the second year. So you need to be clear up front about what the trajectory of revenue might be, or else you're setting yourself up for disappointment and criticism, frankly. On the second point, your regulatory structure is very much intertwined with how much tax revenue you can expect to raise under any of these approaches. So we're a tax policy shop. We don't have opinions on what your licensing rules should be or where retailers should be able to open. What we do know, though, especially from the California evidence, is that stricter rules on that front tend to restrain the legal market and result in less revenue. So it's a trade-off you have to be aware of here. There's absolutely a give and take between more regulation and less revenue. There's a tension there. The third point I would recommend, based on what I expect is going to happen to cannabis prices, I would recommend including some kind of quantity tax in the mix. I'm not saying you have to base your tax system entirely on quantity, but I think it has a role to play. It could be based on plant material or on THC content. I think both approaches have merits. A fourth approach, this is really a lesson from the end of federal alcohol prohibition. The federal alcohol tax was phased back in gradually when prohibition ended. And that's actually the approach New Jersey is taking right now with cannabis. The idea is to have a lower tax rate in those very early days when we expect prices to be highest, when the legal market is really trying to gain its footing. But then when the legal market matures, when prices start to come down, as we've seen in Oregon, as I mentioned, then the industry is able to handle a bit higher tax rate. So that would be a case for maybe, phasing in a tax over time. And then finally, this is a little bit of a departure. I've been talking mainly about how you tax the sale of cannabis, but you also, you should have on your radar how you want the industry to fare under the income tax. The basic issue here is the federal tax code denies business expense deductions to cannabis retailers that every other industry is taking for granted. So I'm talking about deductions around wages or, benefits paid to employees, even your rent. If you're choosing to make cannabis legal in Maryland, I think there's a good case to be made for allowing legal retailers to claim the same deductions as any other legal business. Now, the way to do that would be from decoupling from a part of federal law called 280E of the federal tax code. Whether you want to decouple in full or in part, I think is a debate that you could have. There are some experts that have suggested you might not want to decouple in the areas of marketing and advertising expenses, because if you're allowing write-offs for advertising, it could potentially lead to more advertising of cannabis, which, depending on your regulatory approach, might not be something you're interested in. But I think giving those income tax deductions a look is worthwhile, and that should be on your radar as well. And that's really it. My last slide is a link to some of our more research on this topic. But otherwise, I hope that was helpful. And again, thank you very much. I appreciate being able to speak with you today.
All right, thank you very much. We'll go now to Will Tilburg, who will talk about the mathematical analysis here.
Good morning. Thank you, Mr. Chair, members of the work group. Again, Will Tilburg, the Executive Director for the Maryland Medical Cannabis Commission, state's regulatory body for the medical cannabis program here in Maryland. Before I get to my piece, I hope everyone really appreciated what we just heard from Mr. Davis. I saw, Mr. Chair, you taking notes. This is very helpful information, and I hope everybody was really paying attention. 2 points that I took out of it: building programs for the future. What cannabis looks like today is not what it looks like 3 and 5 years from now. And if adult use is the next step for this state, if you're building a program based on what today looks like, it's setting it up for failure down the line vis-a-vis federal legalization, interstate commerce, et cetera. And then second, that revenue year one is not what revenue looks like in year 5 or 10 and beyond. And a lot of the particularly early adopter states overestimated tax revenue early on. It got there, but it does take time to build up. With that said, thank you again for the opportunity to speak today. As a reminder, since I was at the last meeting, the commission does not take a position on the legalization of adult use, but given our unique role and perspective as the state's medical regulatory body, we want to provide as much information as possible to you all in the work group and the General Assembly at large. And as part of that, we're founding members of the Cannabis Regulators Association, a group of 30 plus state regulators across the country, nonpartisan group working on lessons learned and best practices in the cannabis space. I have learned a lot. Our staff have learned a lot from this group about what has worked and what has not worked in other jurisdictions. We're happy to share that. We're actually working on information related to taxation, social equity, and other metrics to be shared with this body and the General Assembly in the coming weeks. The second piece, and what will be the focus of my talk today, is a 2020 study that MMCC commissioned from Mathematica. So in coming out of the, next slide, please, sorry. Coming out of the 2019 legalization work group, there was a lot of, that was unknown. A lot of the recommendations that came out of the work group were we need to learn more information. And so the commission went ahead and had this comprehensive market analysis of medical and adult use cannabis developed. And so that's what I'm going to be sharing, specifically the tax revenue piece of that. Second, I want to highlight a case study in the state of Massachusetts. I believe that's probably the best comp today for Maryland when we look at states that have operational adult use programs. And then third, I want to follow up on Delegate Lukey's questions at the last work group meeting related to tax functionality and what this looks like in the transition from a medical only to a medical and adult use program. Next slide, please. So this report that I referenced again, the 2019 legalization work group met several times. They had recommendations, and among those recommendations, we're conducting a market analysis to estimate the potential economic impact of adult use legalization here in Maryland. Then going forward into the 2020 legislative session, there were multiple legalization bills in both the House and Senate, and the committees overseeing those had a lot of questions about what the impact would be from an economic perspective, as well as a public health and safety perspective. And so the commission issued 2 RFPs, one for the public health and safety impact of adult use legalization, and 2 for the economic impact. And that's what I'm going to touch on here today, is that economic impact. So this RFP that we issued in the spring of 2020 requested a market analysis of the economic impact of legalizing adult use cannabis in Maryland. And it focused on 4 areas: sales and business tax revenue, law enforcement costs related to the illicit market, regulatory costs, revenues, and state public health expenditures, and lastly, income tax revenue from new jobs and hotel tax revenue. So again, this was an RFP, so we solicited competitive bids. We received 5 bids and ultimately selected Mathematica Policy Research, which has conducted several similar analyses, including for one for the state of Massachusetts in 2018, as their program was about to be operationalized. So this award was made in August 2020. The report was then published in December of 2020 and shared with members of the General Assembly. Next slide, please. So what did the report look at? Again, it's a 60-page report. It covered a lot of different areas. Today, I'm just touching on the narrow state tax revenue piece. And so the methodology for that was first conducting a comprehensive literature review to identify studies that estimate the causal impact of adult use legalization. And so the Mathematica researchers limited that search to peer-reviewed studies in 2018 or later. So that is the highest quality studies of causal impact, and looking at the most recent studies at the time. They then ranked these studies based on the strength of the methodology and the causal evidence that came out of that. So they combined then that comprehensive literature review and the data that came out of it with secondary data sources to estimate first our overall state population of adults, and the rate of cannabis use among Marylanders. To do this, they looked at what's generally considered the gold standard of surveys, American Community Survey, the Behavioral Risk Factor Surveillance System, and the National Survey of Drug Use and Health. So they took that comprehensive literature review, those secondary data sources are what come together as the analysis. And the analysis itself was a Monte Carlo method simulation, so 10,000 simulations. And from that, Mathematica took the median values across all of the metrics and provided 75% confidence intervals in their report. Next slide, please. So then what actually were the inputs and the projections that came out of it? So for inputs, first 10% wholesale and retail tax, and then also a separate run for 15% wholesale and retail tax. As Mr. Davis referenced, these are price-based taxes. And at the time of the analysis, that was pretty much every jurisdiction that had adult use cannabis. That's what they were doing. That's what all of the previous adult use legislation bills in Maryland had utilized. And so that's what we at MMCC asked for in the analysis across those different percentages. The wholesale price input was 45% of the retail price, which reflected the Maryland market based on data we provided to Mathematica. The input based on causal studies showed that medical patient numbers would decrease by 8% to 48%. So again, that's on what happened in other states. Based on the secondary data sources, the estimation was that about 10% of Maryland's adult population, or 450,000 people, would purchase and utilize the adult use market. And then, but not every user is the same. So there were levels of use identified in the study from new, regular, and heavy. And each of those groups were based on the number of times it would be anticipated they would be using cannabis within a month, with heavy use at 21 days or more. And then also varying levels of amounts per use. So heavy users are not only the individuals that use most frequently, they also use the most in a single setting. And so, there can be a relatively small number of heavy users that reflect a larger outsized portion of the market ultimately. Cannabis sales, again, this next bullet came from MMCC. Cannabis sales will be exempt from the state's 6% sales tax. That again was a reflection of the most recent legislation that had been introduced in Maryland. And the retail price that was input was from between $10 and $15 per gram. That was based on two separate data points. First, a look at crowdsourced websites that exist to share illicit and legal market prices. So here in Maryland and other jurisdictions, as well as price data obtained from MMCC directly. The projections then that came out of it are that 3 times the number of adult users would exist compared to the current medical market, and that 2 times the amount of cannabis consumed would be consumed compared to the current medical market. And again, that relates to, you're saying, well, if it's 3 times the number of users, why isn't it 3 times the amount? There are these different groupings of users with the heavy, regular, and new. And actually above heavy are the medical users who in a frequency and an amount do consume more than even heavy users across jurisdictions. Next slide, please. So then what were the report findings? And again, this is looking specifically, it was a big report, but this is looking specifically at market size and the tax revenue at the state level. So it did not include local taxes, and also business income tax. The study also focused on year 2. As we heard from Mr. Davis, there can be fits and starts with the implementation of these programs. It takes multiple years to really to find a firm footing. And so Mathematica looked at the second year of operations for a better sense of where revenues would be. And again, this is likely to increase over time. So in year 2, the estimation was about 240,000 pounds of cannabis would be consumed. That was the median amount from their analysis. And that is about double the amount of the current medical market. The high end estimate for that, so at the other end of the confidence interval, was about 316,000 pounds, again in year 2. And that would lead to a total market size and sales of about 1.2 billion. So that is adult and medical. And one of the difficult things to tease out is how much of that 1.2 is adult use versus medical, particularly in those early years. What is going to be the amount of transition of a medical cannabis patient to an adult use user? We know some will, but what percentage will? That's dependent on a lot of factors that are subject to the legislation that the General Assembly would pass. In terms of taxes, state tax income, and then the business income tax, at the 10% level, year two estimated 99 million. At the 15% level, year two was at 117 million. You can see those confidence intervals. They're very wide. That's because there's a significant amount of uncertainty related to particularly early revenue generation with the cannabis tax. We'll talk about some of the reasons for that on the next slide. In terms of business income tax for year two, 40 million at the 10% level, 36 million at the 15% level. I've included at the bottom of this slide revenue increases in certain jurisdictions, listing here Oregon and Nevada. And you can see that they have somewhat different approaches to adult use cannabis. One, in the number of retail establishments they have. Oregon has about 750 today versus Nevada with about 80, although that will be increased significantly in Nevada here in the next year or two. And then also their approaches to taxation. Oregon has a 17% retail tax, whereas Nevada has a combination of wholesale and retail at a combined 25% level. What you see from years 1 through 4 is revenue starts slow. So year one in Oregon, 68 million, year one Nevada, 57. That bumps up to year two, 94 and 99 respectively. And then where they are in the most recent years, 158 and 157 million respectively. So the revenue does increase each year. This is with prices in each of these jurisdictions also falling. Next slide, please. Okay, so the limitations of this study, and there are several. And the first is that it did not include the state sales tax. So that impacts overall price. That will impact how many individuals are purchasing from the legal market. Second, no two adult use cannabis programs are alike. They vary across several important metrics for a study like this: tax rates, the number of outlets, how quickly the program became operational, the number of adult use jurisdictions in the surrounding states, whether home grow is prohibited, whether medical patients are allowed to home grow, or whether all residents are allowed to utilize home grow. So these and many other factors go into ultimately what that revenue looks like, and no two states are really the same there. Third, limited data from adult use states at the time of this study in 2020, which was really based on 2019 data in years prior, particularly those similarly situated to Maryland. So as Mr. Davis referenced, a lot of the early adopter states are Western states. Those models do not look anything really like what we've seen first in Massachusetts and Michigan, and more recently in New York, New Jersey, and Connecticut, which are not yet up and running. Fourth, national cannabis surveys, national use surveys typically underestimate the amount of cannabis use among adults. So this may be a lower estimation than what we would anticipate to see in actuality. And then lastly, and I mentioned this briefly earlier, the amount of medical cannabis patient population that transition to adult use varies among states for a lot of different reasons. One is tax rate, is medical tax itself, is their home grow. So there's a lot of factors that go into that. And as I said, the medical cannabis users tend to be among the heaviest users of cannabis in terms of frequency and amount. And so the number and how quickly those patients transition to adult use, if they do, does impact the revenue that a state's going to see. Next slide, please. So as I referenced, the Mathematica study was based on data really from 2019 and prior. And so Oregon and Washington, Colorado are the first states, 2012 to 2014, to pass these laws. And with others coming online after, it's only a handful of states, only a handful of years, and their laws don't look particularly a lot like what you see in Eastern markets. And so they may not be the best comp for a state like Massachusetts. I've identified Massachusetts as a better comp, and since the Mathematica report was completed, we now have more years have passed. We have more economic data from the state of Massachusetts as their program has become operational. And so I think that can also, provide input to this body as they consider legalization. So why Massachusetts? First, similar populations. They're both between 15 and 20 in the United States, and in population between 6 and 7 million. Physical size, relatively small states. They have several bordering states with Massachusetts. It's Maine, New Hampshire, Vermont, New York, Connecticut, and Rhode Island. So a lot of neighboring states, and most of those states have adult use. That's what we're going to see here with Maryland in the coming years. We already have DC and Virginia, nearby New Jersey. Pennsylvania is looking at it. And so there are existing adult or soon to be adult use states surrounding. Relatively recent adopter of cannabis in Massachusetts. They initially passed the law in 2016 and implemented in November of 2018. And they are, I think, perhaps most importantly, the most developed adult use cannabis market on the East Coast. And again, there is pretty large division between what markets look like on the East Coast versus those early adopters on the West Coast. Next slide, please. So that's the why of Massachusetts, what actually ended up happening. So within Massachusetts, there is a 17% total tax. That's at the register. 10.75% is an excise tax on sales at the register. 6.25% is their standard sales tax. They have about 165 dispensaries. That compares to the 101 that are authorized within Maryland for the medical program. And in recent adult use legislation over the last couple of years, that number has been doubled to about 200 for an adult use market. So what is then the tax revenue? Year one, 5.2 million. As I referenced, that those sales began in November. So very few stores and a very limited amount of time within that year. So really the first full year, 75.6 million. 2020, 116 million. And again, this is just state revenue. There was substantial local taxes also levied that are not included here. There's a bit of an asterisk for 2020 because that 116 does not include the 8 to 10 weeks that adult use stores were closed related to the pandemic. So that number is a little bit artificially decreased. And then 2021 through the end of November, sales have exceeded $1.17 billion in the adult use market, an additional 279 in the medical market. And so the estimated tax revenue for the state through November, with an additional month left, is about 198 million in Massachusetts. So pretty significant growth within those first 3 years. That is, not exactly what happens in other states, particularly those Western states, but it is the trend that the number of years that pass, more stores come online, more individuals use. So there is a higher revenue. Next slide, please. So then switching gears to the third topic, this just very briefly on the tax functionality of seed to sale software. The question was raised at the last meeting about whether and how taxes are applied in other jurisdictions at the wholesale versus retail level, and then how with RFID tagging in the state seed to sale system, how does that work? And can you switch between a medical product and an adult product if there is a surplus in one area or the other? And so as background for the work group, within statute, the commission was required to get a product tracking system or seed to sale software for all levels of the program. So grower, processor, dispensary, all have to use our current seed to sale operator metric. And so information is in at the grower, processor, and dispensary levels, including price and weight. The initial contract that was awarded at the outset of the program is set to expire in 22 in August. And so we are in the process of issuing a new RFP that actually went out in October. And it does contain a piggyback provision that allows MMCC or its successor agency to use that software in the case of adult use legalization. So it can be used for licensing, for product tracking, and also for tax capabilities. MMCC specifically went back to our current vendor, Metric, to ask about their tax capabilities. Their response was listed here at the bottom of the slide. Tax functionality is built into the system. It can be turned on almost immediately for excise and sales taxes. And this allows the regulator to run reports to reconcile tax obligations. What it does not do is set up an automatic payment or debit system or allow for the businesses to make their tax payments. So this is really just reports to identify what the obligations are. The seed to sale operator, whether it be Metric or a successor entity, can build out specific functions for the state. That does take a little more time in their experience in other jurisdictions. And Metric is the operator in most of the adult use jurisdictions currently. That build out can occur with between 90 days and 6 months. I would add to that at the last work group meeting, Jeff Kelly, executive director for the Alcohol and Tobacco Commission, did reference that he had conversations with the tax software provider for the comptroller, and that there was an estimate of 12 to 18 months in order to get a debit system set up so that businesses, specifically for cannabis, so that businesses could pay through that as other businesses do within the state. So that's not what Metric or another seed to sale operator would provide. That's something different. And that is one of the reasons what you see in a lot of jurisdictions is either the adult use regulator is the tax collector within the state, or there is a division of labor where there is a regulator of cannabis, and then there is separately the tax collection. I think that completes my presentation for today. Thank you very much for your time. And at the end, I'm happy to answer any questions. Thank you.
Okay, thank you very much. And now we're going to go to Stan Ward, who will make his presentation here on local cannabis taxes. And then we're going to take questions. Members of the work group, if you would like, you can start to raise your hands now and I'll keep track and we'll be ready to go. All right, let's go ahead with you, Stan Ward.
Thank you, Mr. Chairman. I'm just going to take a few minutes. My presentation will be brief, but it's going to focus on a few special issues related to local cannabis taxes that the work group may want to consider. Next slide, please. So my presentation is going to have 3 parts. First, we're going to focus on local cannabis taxes in other states. Then we're going to look at some key points about local taxing authority here in Maryland, and then just some policy issues to consider concerning local cannabis taxes. Next slide, please. So this is just a summary of local cannabis taxes in other states. Of the 19 states that have legalized recreational cannabis, 16 of them do have local cannabis taxes. 11 states allow a local tax that applies only to cannabis. 10 states allow local general sales taxes to apply to cannabis. And as you may know, in other states, it's quite common for local jurisdictions to have the authority to impose a general sales tax. 9 states give local governments the option whether to impose a local cannabis tax. 2 states make the local cannabis tax mandatory. And 8 states limit the maximum rate of a local cannabis tax, generally to 3% or less. And I should also mention here that there are several states that both allow a local cannabis specific tax and the local general sales tax to apply to cannabis as well. Next slide, please. So this looks just a little more closely at California in particular. California places no limit on local cannabis business taxes. These taxes are imposed as a percentage of gross receipts of a cannabis business or based on the square footage of a cannabis business. The local taxes are as high as 15% of gross receipts. Several large jurisdictions impose a 10% tax rate, including Los Angeles. These local taxes are in addition to 2 state cannabis taxes and state and local general sales taxes. The cannabis industry in California blames the high combined tax rate for keeping a large portion of the cannabis industry underground. Next slide, please. So this is just some key points about local taxing authority in Maryland. Maryland, as you know, does not allow general local sales taxes, although there are certain local sales taxes in a few counties on things like telecommunications and energy. Local taxing authority is determined by the General Assembly. The power to tax is not part of local home rule. As a result, most counties and all municipalities would need authority from the General Assembly to impose local taxes on cannabis. However, there are 3 jurisdictions, Baltimore City, Baltimore County, and Montgomery County, that have been granted special broad taxing authority, and they could tax cannabis under current law if it became legal. And just for context, state law does actually prohibit local taxes on alcohol and tobacco. Next slide, please. And then just finally, these are some of the policy issues that the work group may want to consider. Should local governments be allowed to tax cannabis? Another option would be to give local governments a portion of the state cannabis tax revenue instead of authority to impose a local cannabis tax. And there are several states that do that. Should there be a limit on the maximum rate of a local cannabis tax? Should any municipal cannabis tax be in addition to or in lieu of a county cannabis tax? And finally, should the authority of Baltimore City, Baltimore County, and Montgomery County to tax cannabis be limited or made the same as other jurisdictions? And that's the end of my presentation. Happy to take any questions.
All right, we've heard from all three. I'm ready to take any questions that people may have. I'm going to start with Delegate Nicole Williams, and we'll go to Delegate Ludke. Delegate Nicole Williams.
Yes, thank you, Mr. Chair. This question is for Mr. Ward. I appreciate the information with regards to the local taxes. I guess one of my questions that I have, and I don't know if you would need to come back to us with this information, with regards to the jurisdictions that do have local taxes, what does the illicit market look like in those jurisdictions? I know with the previous presentation on just the general tax scheme in general, talked about kind of what New Jersey was doing and phasing it in an effort to try to tamp down the illegal market. But I'm curious about if a local tax was imposed, what effect that would have on an illegal market as well in those jurisdictions, if we have that information.
Sure. I do know that the industry in California thinks that the local tax is a major contributor to a larger illegal market in that state. But there are, as I think other speakers alluded to, there are other factors that contribute to that, including the level of regulation, the size of the pre-existing illegal market, the number of outlets that are allowed, and the degree of enforcement against illegal operators. I believe, but I guess there's a sort of a counterpoint is that the state of Washington also has very high combined taxes on cannabis. And my understanding is that they've had less of a problem with persistent illegal market. But other speakers may be able to speak to that more completely than I was able to. And I should mention Washington does not have local cannabis specific taxes, although local general sales taxes do apply to cannabis in Washington.
All right, we'll go to Delegate Ludke, then to Delegate Moon.
Thank you, Mr. Chairman. So I have a series of questions focused on tax compliance and enforcement. And Stan, I guess I'll start with you. With alcohol and tobacco, when we moved regulatory authority over to the Alcohol and Tobacco Commission, we kept the taxation in the comptroller's office, right?
Yes.
Okay. So to any of the speakers, I'm curious on the, I assume that, sales tax is a sales tax is a sales tax, and any sales taxes on cannabis would just come through the same processes that any other business uses when they pay the sales tax, when they remit sales tax back to the state. But on the excise tax side, who measures the quantity of, for example, alcohol, or in the case of cannabis, who would measure the quantity, the weight of a cannabis product? Would it be the business themselves? And how are we certain that the process for weighing is not cheated?
On the first point, yeah, I do think a general sales tax, it should be collected like any other. That's what I would expect to happen. On the excise tax side, I'm not familiar with that level of detail on how they make it happen. I mean, there's several examples. I mean, we already have weight-based administration and operation in Nevada, Colorado, Maine, California, and Alaska. And so I'm sure I think the business is weighing in, and I'm sure there's an auditing scheme in place to make sure those weights are done correctly. Presumably, metric could play some role here as well, but at the nitty gritty level of how they're actually doing it, unfortunately, I can't comment in detail, but I could help point you to some resources. I could share some resources afterwards to help show how other states are doing it, because it's definitely being done now. So there are models out there.
I'll just supplement that within the current medical market. The MMCC has regulations on how products are weighed. There is weight entered into metric. And first, the dispensaries, the retailers are not going to purchase a weight if it's not accurate. So at each level, the next business is verifying what has been transferred to them for accuracy. In addition, our staff does conduct virtual audits through metric, as well as going on site and taking products and making sure that spot checking unannounced, announced visits to make sure that the products that are there match the weight that's on the label.
But will sorry, Mr. Tilburg, I guess that incentive by the purchasing business wouldn't be there if it were a vertically integrated firm, right?
You could argue that, yes, but that's the reason you have the audit process. And we have our 20 inspectors. One of their most frequent checks is just that, making sure the weight, and it's also diversion related, making sure that some cannabis didn't disappear. So this is one of the central focuses of our enforcement program.
I should add, if I can, on the THC tax specifically, if you can, I believe what's planned to happen is samples can be sent to multiple labs, and you want to see that the labs are achieving consistent results. And if you get evidence that one lab is consistently, say, overinflating THC, which typically up until now, that's what you would see happen. The businesses would like to claim they're selling very potent product because it can command a higher price. So there was some evidence of lab shopping in limited cases of businesses wanting to find a lab that would reveal a higher THC content. Now, if you're taxing based on THC, maybe you could have lab shopping in the other direction. Businesses are trying to find labs that'll underreport THC to get them a lower tax level. That's not clear that that's actually going to be good for their business, because reporting having a lower amount on the label, customers will pay less for it, presumably. So you have that tension there. There's a little bit of those competing forces of them wanting to command a high price with a high potency level, but getting a low potency level for the low tax. Those tensions can have some leveling out effect and can be helpful from enforcement under that particular mechanism.
Okay, one final question, Mr. Chairman. Thanks for letting me run a little bit. But Mr. Tilburg, do we have, if we were to make a decision to use a THC content-based excise tax, do we have existing lab capacity that would be able to handle that at that scale? Because I would assume we would expect significant increase in the amount of testing necessary.
In the current medical market, every product that is sold in a dispensary has gone through testing for potency, so THC.
Right.
So that's already occurring. What Mr. Davis referenced with the lab shopping is something that regulators here in Maryland, across the country, are concerned about. We've done blind round robins to try to this point, because again, it's independent laboratories. It's not a state laboratory that are conducting these tests. So we've done blind round robins, and that sort of leveled out the potency where there may be a lab or two that was having inflated results. That's largely taken care of at this point. But in addition, we are in the process of securing a state reference laboratory where we would be able to conduct compliance and confirmatory testing on what those private labs are doing. And so that would add another layer where we would be able to ensure that the THC figures, if that's the way we want to go with the tax, would be accurate, is having the state, doing its audits through that.
But do the existing private laboratories in Maryland have the capacity to test on the much larger scale that would be required under a recreational market?
They would probably tell you yes. I think it would be an opportunity for additional labs to enter the space. So we currently have 6 registered labs within the state, but there have been 4 to 6 others that have come online and then gone offline because there wasn't enough business. So it's something that it would be another avenue. When we're talking about licensing and opportunities for businesses, this would be another business opportunity for Maryland labs as part of this program with adult use.
Thank you very much. Thank you, Mr. Chairman.
All right, Delegate Moon.
Thank you, Mr. Chair. I know this is a presentation on direct taxation, but I was actually drawn to two aspects that the presenters touched on that I think are slightly askew, but I feel I got to flag them. One is, has anyone taken a look at tax generation vis-a-vis the wealth and the minting of millionaires that is going to happen from this process? Not from the direct, sales or excise taxes on the product itself, but on who the license holders are and who is benefiting from the wealth created by these new businesses. And the reason I ask is this: one of the presenters mentioned the future likelihood of interstate commerce beginning, and with various states at different stages of development with their businesses, I've been very concerned about the very early intrusion of out-of-state and multi-state operators in Maryland. And frankly, I'll drag Delegate Kipke into this. I remember very well when we both sat on the last marijuana work group under the late Speaker Bush, and Kipke and I were both listening to this presentation being like, man, I really hope we're talking about Maryland businesses that we're creating here and wealth in Maryland. I sure hope that's a part of our plan going forward. And in those early conversations, we were talking about that, but I haven't heard much about it now. So there's the direct tax revenue generation. But then my question really is about whether anyone's looked at, has the actual ownership and license, who owns licenses, has there been analysis of the tax generation on that end of it? Because I'd be very curious if my fear is correct, that when you have a Colorado operator swooping in and buying up, as many licenses as they can, sure, we'll get whatever sales or excise tax comes from that. But do we lose all of the, personal, corporate, and other tax generation by virtue of that happening? And of course, if I'm right about that, have any states meaningfully managed to put a sticky policy together that actually traps some of that wealth more cleanly in the state that's generating it? I mean, my fear is, we get a scenario where, we're minting the next Miller Coors companies, but they're all not from Maryland because of the way we may have disadvantaged our folks. So that's the real big question I have. And the second is whether you can validate my theory that states that have allowed home grow haven't really screwed up their tax revenue generation.
Yeah, I mean, to the first point, I mean, absolutely moving this into the legal market now to the illicit market shifts income tax revenue out of a gray market, invisible income and into the system. Now, the extent to which you might have out of state operators, I think that is a concern. If these are pass through businesses passing through their profits to out of state owners, Maryland's ability to tax that is going to be limited, absent, say, an entity level tax. If it's a C corporation, they would be paying corporate income tax revenue. If it's an S corporation, you would need a pass through entity level tax on that business to fully capture their fully tax their profits before they're sent out of state to out of state business owners. Yeah, I mean, I think it's largely though on terms of setting up a licensing structure and a regulatory structure, that's a little bit outside of our area, but I think states are definitely interested in doing that in ways that encourage small business, encourage local business. I worry that, long run, those efforts are going to be difficult to maintain when companies like, say, Altria become involved. It's going to be difficult for some of these small, there is an early starter advantage, But in the wake of like full federal legalization, I think the market is going to look so drastically different. It's a little hard to imagine that all those, even if you do try to set up rules that encourage small business, local business early on, seeing those hold up over the long run, we'll see. But I think this is a market that's in for enormous changes.
Yeah, Delegate Moon, I think you're in the current landscape with cannabis remaining federally illegal, the business income is largely taxed within state. But when we see this transition to interstate commerce is really when your concerns about Colorado or another jurisdiction, or going to Canada, would really exist. And I'm sorry, your second question, because I don't think we got to that.
And sorry, maybe you could just clarify this vis-a-vis the medical market. If we have a medical operator that owns a few licenses in Maryland, but they're based in Colorado, it is the case, right, that currently any revenues, at least from that corporate, did we do anything to trap some of that revenue in Maryland under that scenario?
Yeah, I mean, there's significant business income tax coming into the state from the medical operators. Number one, most of the businesses are Maryland-owned businesses, small local businesses. But number two, even when they are these MSOs, they have to have Maryland entities that are largely, given the federal tax penalties and structure, they're paying their taxes here. So again, that shifts with interstate. But right now, what we see in the medical market is that business income tax largely is going to Maryland.
Okay, we'll go back now to Delegate Lutke for a second bite at the apple.
Mr. Davis, I just want to make sure we clarify some of the comments a second ago about the impact on income taxes if income is earned in Maryland by a business or person that lives outside of the state. Can you describe how apportionment would work in that case with an MSO?
So with S corporations, I'm not familiar with MSOs in particular, but with pass-through businesses in general, one reason that states have shown increasing interest in levying a pass-through entity tax, a C corporation already pays tax at the entity level. A pass-through business that passes its profits on to its owners, the owners pay tax on their individual income tax returns, and you could have situations where if the individual doesn't have sufficient nexus in Maryland, they may not pay Maryland income tax. And so that's the reason why I don't know that with the way the market is structured now, if that's happening on any significant scale. It sounds like it's not, but that's one reason why these pass-through entity taxes have been contemplated at the state level, is to make sure that out-of-state business owners are paying individual income tax. Well, not actually the individual tax, becomes an entity tax instead, but that's the idea.
So the business itself doesn't qualify as nexus for the income tax purposes?
It depends how much the individual is present in the state.
So it's the individual person, not the business they own, that's earning the income.
Right. When they fill out their individual form, whether that's going to be subject to Maryland tax or not, it would depend on how much time they spend in the state, for example.
Thank you.
Are there any further questions for this panel?
I'm sorry, Mr. Chair. Delegate Moon
Please.
had asked a follow-up of the impact of home grow on taxation.
Delegate Moon asked a Judiciary Committee kind of question where he had 14 questions inside the one question, and it was in the great tradition of the committee. So yeah, it doesn't surprise me that we have to take that apart a little bit.
So it
Go
just
ahead, Mr.
popped
Felder.
back into my head. So
That's
I
fine.
appreciate it.
This is, we're used to it. All right.
So the Mathematica analysis that we had performed in 2020 did look at the impact of home grow, and across states, it found that no more than 10% of any users were participating in that. And so it did not have a tremendous impact on overall tax revenue generated by the state.
All right. Any other questions? All right, seeing none, we do thank you all very, very much. We've kept it certainly to time today. Thank you very much. Appreciate your time and expertise here. If any work group members have further questions for our guests today, you can email Dylan at dylangoldberg@mlis.state.md.us and he'll connect you. This is concluding the initial set of overview meetings for the full House Cannabis Legalization Work Group. Over the last few months, thanks to the organizational support of DLS and others, we received briefings related to public health concerns, criminal justice impacts, business implementation, and today taxation. I think it's been important for us to establish a strong foundation of information and context as we move forward and dive deep into this complicated issue and ultimately craft legislation that'll fulfill the promise of this work group. Over the next few weeks, we'll announce the roster of all 4 subcommittees and the subcommittee chairs will then consult with work group staffs to set up a meeting schedule, and meetings will resume during the 2022 regular session. All work group related announcements will be made via email or posted to our work group page on the General Assembly's website, where you can also find the materials from today's briefing. I certainly appreciate everybody joining us over the last couple of months. I hope you found these meetings to be informational and helpful. And they've certainly been very helpful to me. And I look forward to seeing everyone here next week for special session and then again in the session in January. So thank you all very much. Have a happy holidays and a healthy new year. Thank you.